Hi, y'all. My name is Sam Burr. I'm going to talk to you guys a little bit about lung cancer. But before I do that, go ahead and take this quick quiz. So pause your video, take this quick quiz to test yourself on the material before we get into the lesson. All right, great. So lung cancer, what the hell is it? Well, before we can talk about lung cancer, I think it's important to understand what cancer is in general. So let's talk about that first. Have you ever seen The Blob? Well, if you haven't, it's a phenomenal movie about a blob that eats everything. And when it eats everything, it gets larger and larger and larger. Well, cancer is kind of like the blob. Why is that? Well, before we can understand that, we need to go further back in time and understand three concepts. The first concept is that our body is made up of things called cells. So just like this brick wall is made up of individual bricks, our body is made up of individual cells. So you can think of the brick wall as our body, and you can think of our cells as these individual bricks. Second thing to understand is that our cells are always dividing. Why? Well, it's because our cells don't live forever, and we need to replace old cells with new cells that are healthy, right? Let's say, and I'll throw out a random number, that under normal conditions, our cells are only dividing one time a day. Okay, so we'll write that down there and we'll remember that. Third thing to understand is that when our cells are injured, the rate at which they divide goes up. Okay, so let's just say if we're injuring ourselves, now our cells are having to divide 1,000 times a day. And why is that? Well, let's say we step on a piece of glass. All the cells where the glass cut our skin are now dead. And so the living cells need to create new cells to fill in that gap. And they need to do it really quickly. So their rate of division is going to go up. Similarly, if we're smoking cigarettes and we're destroying cells in our lungs, the living cells in our lungs are constantly having to divide really quickly to repair that damage, right? Now, I assign these rates because I want to introduce a fourth concept. Every time our cells divide, there's a chance, a small chance, that one of the cells becomes an erroneous cell. A mistake is made during division and it makes a bad cell, okay? We'll tag this cell as bad cell, okay? Now, if you're dividing 1,000 times a day, the chance that one of those divisions results in a bad cell is a lot higher, right, than the body with cells that are only dividing one time a day, okay? So if our cells are always being injured, the chance that we're creating bad cells goes up, okay? Now, when cells make an error during division, that error can produce a bad cell, and that cell can become cancer. Here's another example that kind of reinforces the point that I just made. Let's say we have a house that lives in an area where there are lots of earthquakes. And then we have another house that lives in an area where there's no earthquakes. We know that every time we have to rebuild the house, there's a chance during the rebuild that a mistake is made. Okay, so maybe we use the wrong wood, maybe we make the bad measurements. But every time we rebuild the house, there's a chance, a small chance, that we rebuild it wrong. Compared to the house that maybe only needs to be rebuilt once every 50 years because there's no earthquakes. The house that's constantly being rebuilt, let's say 5 times a year, has a higher chance of being made incorrectly and becoming a bad house compared to the house that only needs to be rebuilt once every 50 years. I think we can all agree on that. So, like we discussed, those mistakes can happen when cells are dividing. And like we mentioned, if we create a bad cell because our division was erroneous, that cell can become cancer. Okay? So what does cancer do? What does the blob do? Cancer is hungry, okay? We're using the blob to represent cancer. Cancer is hungry, and It wants nutrients because it wants to grow, right? Its main objective is to grow. So that means it's taking nutrients from Fred, okay? If it lives inside Fred, it is sharing Fred's nutrients, okay? So if Fred eats a chicken wing, he'll get some of the chicken wing. Cancer will get some of the chicken wing. So Fred won't get all the food. Cancer will get some of the food. And if that happens, Fred's going to start losing weight. He's going to start feeling tired, right? So we know about cancer now. What about lung cancer? Well, lung cancer is just when the blob or cancer is just living in the lungs, right? So let's look at how this affects the lungs. Here's a picture of our lungs. We'll draw a little head on this guy. I'm not a very good drawer, so just keep that in mind. Okay, so when we breathe, oxygen goes into our mouths, down our windpipe, into these branches in our lungs. And that fills up our lungs with oxygen, right? Now let's say we're, always smoking cigarettes. That smoke is also going to travel down into our lungs, into the branches, and it's going to start hurting the cells in these branches, right? Let's say we're constantly hurting the cells right here in this branch. Well, if those cells are having to divide 1,000 times a day, there's probably going to be a mistake in there somewhere, and that might develop into a little cancer. Now that cancer might grow, and it might grow. Now we've got a big cancer, and it's compressing this airway. It's preventing air from getting to these branches that are further down in the lungs, right? So what happens when that happens? Well, if we're not getting air into part of our lungs, we're going to feel short of breath. We're going to feel short of breath. Like we just can't get enough air. Other thing that could happen is because lots of bacteria actually don't like oxygen, if we're preventing oxygen from getting to these branches, those bacteria are going to start to grow, right? And we might end up with an infection in our lungs. Okay. Third, cancer cells are bad cells, and so they're pretty weak, and they can break, they can burst, all those types of things pretty easily, and that can result in bleeding into these tubes, okay, into these windpipes. And we can end up coughing up that blood. So we might have a bloody cough. And then finally, like we discussed, cancer is taking nutrients from Fred, okay? And if it's taking nutrients from Fred, Fred is going to lose weight. And he's going to feel tired. Okay, so these are some of the symptoms that we look for when we're talking about cancer. So how do we treat lung cancer? Well, it's pretty hard. There's radiation treatments, there's surgery, chemotherapy, okay, special medicines to treat cancer. But it's a lot easier to prevent. Okay, so how do we prevent it? Well, in order to prevent something, we need to understand, well, what causes it, right? So what causes lung cancer? Well, I'll give you a second to take a guess, but if you guessed cigarettes, then you are absolutely correct. Cigarettes are a leading cause of lung cancer because they're constantly damaging cells in our lungs and forcing those cells to divide faster, which increases the likelihood that they make a mistake and become cancer. So the question is, what if I've been smoking my whole life? I mean, can quitting still actually help me? The answer is absolutely. Here's what happens when you stop smoking. Just 20 minutes after quitting, your heart rate and your blood pressure drop. Okay. A few days after quitting, all the smoke, and carbon monoxide that's in your body, that's in your bloodstream, drops to normal. Okay. 2 to 3 weeks after quitting, the circulation of your blood and your lung function increases. Okay. You're starting to breathe a little bit easier. Up to a year after quitting, your coughing and shortness of breath decrease. There are tiny little hairs in your lungs, in those windpipes, that move mucus out of the lungs. They clean the gunk out of the lungs. Those little hairs start to work again, which means we can start cleaning our lungs up, okay? Which reduces the chance of infection. 1 to 2 years after quitting, our risk of heart attack drops dramatically. 5 to 10 years after quitting, our risk of cancers of the mouth, throat, voice box are all cut in half, and your stroke risk decreases. So your risk of having a stroke goes down. 10 years after quitting, your risk of lung cancer is half that of a person who is still smoking, okay? And your risk of cancer of the bladder, esophagus, and kidney go down. 15 years after quitting, your risk of coronary heart disease or risk of having a heart attack is close to that of someone who's never smoked. So our body's ability to heal is really important here, but you need to give it a chance to heal, okay? And if it heals, your chance of developing cancer will go down. Now, what if I want to catch my lung cancer early if I end up developing it? So that the treatments for lung cancer or my lung cancer, if I end up developing it, work better, right? Because it's easier to treat cancer if we catch it earlier rather than later. Well, there are ways to check for cancer to see if someone has it, so that we're able to catch it earlier on. It's called screening, okay? Screening. So the way we screen for lung cancer is starting at age 50, we get an X-ray every year, once a year, until you're 80 years old or until 15 years after your last cigarette. There's very little radiation with this X-ray. It's very safe. But these yearly X-rays can tell us if there's a cancer starting to develop very early on, so we have a better chance of dealing with it. The last thing to understand here is that unless you've smoked for 20 years, you don't need to be screened. So screening is reserved for those who've smoked for 20 years because their chance of developing lung cancer is high enough to justify regular screening, okay? So what if I want to quit smoking, but I just don't know how? What are my options? Well, come talk to us. Let's make a plan that works for you in your life, okay? Even if it's just that you want to reduce your smoking, that's a wonderful goal, and we're happy to help you with that if you are ready. Last thing, just like we took the quiz before we started the video, we'll go ahead and take the quiz again to see what we've learned. So go ahead and pause your video and go through this quiz once more. All right, great. Let's go over it together. So what is cancer? A type of crab. Cells that can't stop dividing and become the blob. An infection, or a cough that never goes away. The best answer here is B, cells that just can't stop dividing because they're erroneous. What usually causes lung cancer? Having asthma as a child, smoking cigarettes, being around things that you're allergic to, or random chance. Well, as we talked about, if you smoke cigarettes, your rate of cellular division is going up. And that means the rate of your cells, or the chance that your cells will make a mistake, is also going up. So smoking cigarettes is therefore a pretty strong cause of the development of lung cancer. When should you start getting screened for lung cancer? Right now, well, I guess that answer depends. Age 50 if I've smoked for over 20 years. Never, screening is useless. Or 80 years old. The correct answer here is B, If you've smoked for over 20 years or have a 20-pack year smoking history, you should start getting screened at age 50. All right. Thanks for your time.